Hello and welcome to the Dr. Health Channel, where we address the most common health issues and provide insights into how to live a better, healthier life. Today, we're talking about a topic that affects many people, but not everyone talks about: digestive discomfort, including excessive gas, strong-smelling stools, bloating, and constipation. If you've ever experienced that uncomfortable feeling of being overly bloated after eating, or if you've been in a situation where your gas or stool odor was so unpleasant that it made others uncomfortable, you're not alone. But here's the truth. While it's normal to occasionally pass gas or a stool that has a slight odor, when it becomes excessive, particularly when it's accompanied by strong, foul smells or when you're constantly bloated, this is a clear sign that something might be wrong with your digestive system. It's essential to understand that your body is giving you signals, and it's important to listen to them. So, if you've been dealing with these issues more often than not, it's time to dive into the root causes and explore solutions. Main causes of digestive problems. When it comes to digestive issues like excessive gas, bloating, and foul-smelling stools, there are several common causes that could be contributing to your discomfort. Understanding these underlying factors is the first step in addressing and resolving these problems. Let's explore the main causes in more detail. 1. Poor diet choices. One of the primary contributors to digestive problems is the type of food you consume. Your diet directly influences how your digestive system functions, and eating the wrong types of foods can wreak havoc on your gut. Here are some dietary habits and foods that commonly cause issues. Processed foods and refined sugars. These foods are low in nutrients and fiber, which means they can slow down digestion and create an imbalance in your gut. When you eat foods high in refined sugar and artificial additives, it can lead to an overgrowth of harmful bacteria in the intestines, contributing to bloating, excessive gas, and discomfort. Additionally, processed foods often contain unhealthy fats that can be hard for the body to digest and can slow down the digestive process, leading to constipation. High-fat meals. Meals that are rich in unhealthy fats, such as fried foods, fatty meats, or creamy sauces, can overwhelm your digestive system. These types of foods take longer to break down, causing a backup in your digestive tract and leading to a feeling of fullness, bloating, and sluggish digestion. Over time, this can also contribute to poor bowel movements and irregularities in your stool. Fiber-rich foods. In moderation, while fiber is essential for a healthy digestive system, eating too much fiber too quickly can actually cause bloating and gas. Foods like beans, lentils, cruciferous vegetables, broccoli, cabbage, Brussels sprouts, and whole grains are high in fiber and can lead to increased fermentation in the gut, producing more gas as a byproduct. For some people, this can be a major source of discomfort, especially if they aren't used to consuming a lot of fiber. Dairy products. For those with lactose intolerance, if you're lactose intolerant, consuming dairy products can cause a variety of digestive issues. The body struggles to break down lactose, the sugar found in milk, leading to symptoms like bloating, excessive gas, diarrhea, and stomach cramps. Many people are unaware that they have lactose intolerance until they start noticing these digestive disturbances after consuming dairy. 2. Digestive disorders. Another key cause of digestive symptoms like gas and bloating is the presence of underlying digestive disorders. Some common conditions include irritable bowel syndrome. IBS is a functional digestive disorder that affects the large intestine. It is characterized by a combination of symptoms, including bloating, diarrhea, constipation, and excessive gas. The exact cause of IBS is unknown, but it is believed to involve irregular contractions of the colon and heightened sensitivity to digestive processes. Food intolerances and sensitivities. Besides lactose intolerance, many people have sensitivities to other foods such as gluten, wheat, or certain carbohydrates, FODMAPs. These food intolerances can lead to uncomfortable symptoms like bloating, cramping, and gas. For instance, those with gluten sensitivity may experience digestive distress after eating foods containing gluten, while others may struggle with certain fermentable carbohydrates that don't digest well in the intestines. Gut dysbiosis. The balance of bacteria in your gut plays a crucial role in digestion. If you have an imbalance in gut bacteria, known as dysbiosis. It can lead to problems like excessive gas, bloating, and foul-smelling stools. Dysbiosis can result from a poor diet, antibiotic use, chronic stress, or other factors that disrupt the natural microbiome of the gut. 3. Stress and its impact on digestion. Believe it or not, stress can have a significant impact on your digestive health. The connection between the brain and the gut is often referred to as the gut-brain axis, and it means that emotional and psychological stress can directly affect how your digestive system functions. When you're stressed, the body's fight-or-flight response kicks in, diverting blood and energy away from the digestive system, which can slow down digestion. Chronic stress can lead to a range of digestive symptoms, including bloating, constipation, and increased sensitivity to gas. Stress also affects the gut microbiota, potentially exacerbating conditions like IBS and leading to an imbalance in the good and bad bacteria in the gut. Over time, this can result in more persistent digestive discomfort and exacerbate symptoms like bloating and foul-smelling gas. 4. Inadequate water intake. Another often overlooked factor is dehydration. When you don't drink enough water, your digestive system struggles to function properly. Water helps break down food, absorb nutrients, and move waste through the intestines. When you're dehydrated, your body has to work harder to process food, which can lead to constipation and bloating. Inadequate water intake can also thicken your stool, making it harder to pass and contributing to discomfort. Warning signs of more serious issues. While occasional digestive discomfort, such as bloating or mild gas, is often nothing to worry about, there are times when these symptoms could be indicative of more serious underlying conditions. It's essential to listen to your body and pay attention to any persistent or worsening symptoms. Ignoring these signs could lead to the delay of proper diagnosis and treatment, especially when the problem could involve something more severe. Below, we'll discuss the warning signs that suggest you may need to consult a healthcare professional. 1. Persistent or worsening symptoms. If you've been experiencing digestive symptoms like bloating, gas, or unusual stool odor that persists for weeks or even months, or if these symptoms seem to be progressively getting worse despite changes in your diet, it's a clear warning sign that something may be wrong. Chronic bloating, for example, isn't just an inconvenience. It can indicate an imbalance in your gut microbiota, the community of bacteria living in your intestines, or a slower digestive process. Similarly, excessive gas or frequent episodes of foul-smelling gas can suggest malabsorption issues, where your body is having difficulty processing and absorbing nutrients from food properly. Even minor, temporary bloating after eating certain foods can be normal, but if it becomes a daily occurrence, it's time to dig deeper into the possible causes. Common conditions associated with persistent digestive symptoms. Irritable bowel syndrome. IBS, a condition that affects the colon and can cause cramping, bloating, diarrhea, and constipation. Symptoms often come and go but may worsen if left untreated. Lactose intolerance or food sensitivities. Difficulty digesting specific foods, like dairy, can lead to chronic gas and bloating. Gastroparesis, a condition in which the stomach empties too slowly, leading to chronic fullness, bloating, and nausea after eating. Intestinal dysbiosis. An imbalance of gut bacteria can lead to bloating, excess gas, and digestive discomfort, especially after meals. 2. Blood in stool or unexplained weight loss. One of the most alarming warning signs is the presence of blood in your stool. Even small amounts of blood, whether bright red or darker in color, which may suggest blood from higher in the digestive tract, should never be ignored. Blood in the stool can be a sign of several serious conditions, such as hemorrhoids. Although not typically life-threatening, hemorrhoids can cause bleeding and discomfort. If you're experiencing other symptoms like pain or swelling around the anus, this might be the culprit. Gastrointestinal bleeding. More serious conditions, such as bleeding ulcers or inflammation in the intestines, due to Crohn's disease or ulcerative colitis, can also result in blood in your stool. If you notice persistent blood, or if it's accompanied by pain or weakness, it's essential to consult a healthcare professional. Colon cancer. While much rarer, blood in the stool especially if combined with unexplained weight loss, abdominal pain, or a change in bowel habits, can be an early warning sign of colorectal cancer. Early detection is critical, so if you see any unusual changes in your stool, don't hesitate to seek medical advice. Unexplained weight loss, especially when it's paired with digestive symptoms, is another serious red flag. If you're losing weight without making changes to your diet or exercise routine, it may be a sign that your body is not absorbing nutrients properly. This could be due to conditions such as celiac disease, an autoimmune disorder where the ingestion of gluten damages the lining of the small intestine, preventing nutrient absorption, malabsorption syndromes. These are conditions where the body cannot effectively absorb nutrients from food, often due to issues with the pancreas or intestines. 3. Severe abdominal pain or cramping. While occasional stomach discomfort is normal, severe or chronic abdominal pain that comes and goes, or is associated with other symptoms like bloating, nausea, or changes in bowel habits, should not be ignored. Intense or sharp pain can signal a number of issues, including gallstones or gallbladder disease, pain in the upper right abdomen, especially after eating fatty foods, could indicate problems with your gallbladder, pancreatitis. Severe, constant pain in the upper abdomen may suggest inflammation of the pancreas, often accompanied by nausea or vomiting. Intestinal obstruction. A complete or partial blockage in the intestines can cause sharp, cramping pain, bloating, vomiting, and constipation. 4. Sudden changes in bowel habits. If you suddenly notice changes in the frequency, consistency, or color of your stools, it could be a sign that something is wrong. For example, diarrhea or constipation for extended periods. Persistent changes in bowel movements, such as diarrhea lasting more than a few days or constipation that won't resolve, could indicate conditions like IBS infections or even early signs of more serious diseases like colorectal cancer. Black or tarry stools. If your stools are dark or black in color, it may signal bleeding higher up in the digestive tract, such as in the stomach or small intestine, which requires immediate medical evaluation. How stress affects your digestion. You might not realize it, but stress has a profound impact on your digestive health. The link between the brain and the gut is more powerful than most people think. And when you're stressed, your digestive system can become severely affected. In fact, stress is one of the most common, yet often overlooked, triggers of digestive issues like bloating, excessive gas, constipation, and even foul-smelling stools. Understanding the connection between your mind and gut is essential for identifying the root causes of these symptoms. 1. The gut-brain connection. The gut-brain axis is the term used to describe the direct communication pathway between your brain and your gastrointestinal GI tract. This two-way street allows signals to travel both ways, meaning that not only can your gut send signals to your brain, but your brain can also send signals to your gut. This connection is why you might feel butterflies in your stomach when you're nervous, or why stress can cause a knot in your stomach. When you're stressed or anxious, your body enters a fight or flight mode, activating your sympathetic nervous system. In this state, your body is prepared to either fight or flee from danger, which leads to the release of stress hormones, particularly cortisol and adrenaline. These hormones have a powerful impact on your digestive system, and here's how. Slower digestion. When you're stressed, blood is diverted away from your digestive organs and directed toward your muscles and limbs, preparing your body for action. As a result, your digestion slows down. This can cause food to stay in your stomach longer, leading to bloating, indigestion, and even discomfort after eating. Additionally, slower digestion can contribute to constipation, as waste material moves more slowly through the intestines. Increased acid production. Stress can also trigger an overproduction of stomach acid. Excess stomach acid can irritate the lining of your stomach and intestines, leading to heartburn, acid reflux, or even gastritis. This acidity can worsen symptoms of bloating and discomfort, and it can affect the consistency and odor of your stool. Changes in gut motility. The nervous system controls how quickly food moves through your intestines. Stress can disrupt this normal motility, causing either diarrhea, if the gut speeds up, or constipation if the gut slows down. These changes in bowel movements can lead to either loose stools or a sense of being backed up, both of which are unpleasant and can exacerbate bloating and gas. Increased gas production. Stress can also affect your gut microbiota, the trillions of bacteria living in your digestive system. Under stressful conditions, the balance of good and bad bacteria can shift, leading to an overgrowth of harmful bacteria. This imbalance can result in increased gas production, bloating, and foul-smelling stools. In some cases, stress can even make conditions like irritable bowel syndrome, IBS, or small intestinal bacterial overgrowth, SIBO, worse. 2. Emotional stress and gut sensitivity. It's not just the physical symptoms of stress that can affect your digestion. Emotional stress can also have a profound impact. Anxiety, depression, and ongoing mental strain can alter the way your brain communicates with your gut, heightening sensitivity to pain and discomfort. This means that the mild discomfort you may experience after a meal can feel much worse when you're stressed or anxious. Emotional stress can also make you more prone to symptoms like nausea, stomach cramps, or even a lack of appetite, further complicating digestion. 3. The vicious cycle of stress and digestive issues. The relationship between stress and digestive problems is cyclical. Digestive discomfort caused by stress can, in turn, increase your stress levels. For example, if you experience bloating or gas after eating, it can lead to feelings of frustration or anxiety. The more you worry about your digestive symptoms, the more stressed you become, which, as we've just learned, can worsen the symptoms themselves. This vicious cycle can be difficult to break, but understanding the connection is the first step in managing your digestive health effectively. Dietary and lifestyle changes for better digestion. Improving digestion often requires a combination of dietary adjustments and lifestyle changes. While medications can provide temporary relief for digestive issues, long-term results depend on making sustainable changes to your daily habits. If you're experiencing bloating, gas, or other digestive discomforts, here's a detailed guide to what you can do to support your gut health and enhance overall digestion. 1. Adopt a gut-friendly diet. Your diet plays a fundamental role in maintaining digestive health. Making conscious food choices can significantly reduce symptoms and improve the efficiency of your digestive system. Here are some key dietary adjustments. Increase fiber intake gradually. Fiber is essential for healthy digestion as it adds bulk to stool and helps it pass more easily through the intestines. Include fiber-rich foods such as whole grains, fruits, e.g. apples, pears, vegetables, e.g. leafy greens, carrots, and legumes in your diet. However, introduce fiber slowly to avoid sudden bloating or gas as your body adapts. Stay hydrated. Drinking enough water is crucial for digestion. Water helps break down food and keeps your digestive tract lubricated, preventing constipation. Aim for at least 8 to 10 glasses of water daily, adjusting based on activity levels and climate. Limit processed foods. Processed and fried foods can be hard on your digestive system. These foods are often high in unhealthy fats and low in fiber, making them more likely to cause bloating, constipation, or gas. Incorporate fermented foods. Fermented foods like yogurt, kefir, kimchi, sauerkraut, and kombucha are excellent sources of probiotics, live beneficial bacteria that support a healthy gut microbiome. These foods can help balance gut bacteria and improve symptoms like bloating or irregular bowel movements. Choose easily digestible proteins. Opt for lean proteins such as chicken, fish, or plant-based options like lentils and tofu. Avoid heavily processed or fatty meats, as they are more challenging for your body to break down. 2. Practice mindful eating. How you eat is just as important as what you eat. Mindful eating can help reduce digestive discomfort and make meals more enjoyable. Chew thoroughly. Chewing your food thoroughly breaks it down into smaller particles, making it easier for your stomach and intestines to process. Aim to chew each bite 20 to 30 times to support optimal digestion. Avoid overeating. Eating large portions can overwhelm your digestive system, causing discomfort and bloating. Try eating smaller, more frequent meals throughout the day to give your body ample time to digest. Reduce distractions during meals. Focus on your food while eating. Avoid distractions like watching TV or scrolling on your phone, as this can lead to overeating and improper chewing. 3. Address food sensitivities. Certain foods may trigger digestive issues, depending on your body's unique sensitivities or intolerances. Consider the following steps to identify and address these triggers. Keep a food diary. Track what you eat and how it makes you feel. This can help you identify specific foods that cause symptoms like bloating, gas, or discomfort. Test for intolerances. If you suspect you have food intolerances, such as lactose intolerance or gluten sensitivity, try eliminating these foods for a period and observe any changes in your symptoms. Reintroduce them slowly to confirm their effects on your digestion. 4. Incorporate regular physical activity. Exercise plays a vital role in supporting digestion by promoting healthy bowel movements and reducing bloating. Aim for at least 30 minutes of moderate physical activity most days of the week. Activities like walking, yoga, and stretching are particularly beneficial for improving gut motility and relieving discomfort. 5. Manage stress effectively. As discussed earlier, stress has a significant impact on digestion. Implementing stress reduction techniques can help improve your gut health. Here are some strategies. Practice relaxation techniques. Activities like deep breathing, meditation, or progressive muscle relaxation can help calm your mind and reduce stress-related digestive symptoms. Get enough sleep. Quality sleep is essential for the body to repair and restore itself, including your digestive system. Aim for 7 to 9 hours of uninterrupted sleep per night. Engage in enjoyable activities. Pursuing hobbies and spending time with loved ones can help reduce overall stress levels. 6. Stay consistent with good habits. Consistency is key when it comes to dietary and lifestyle changes. While it may take time to see significant improvements, sticking to these habits will gradually support better digestion and overall health. When to seek professional help. While many digestive issues can be resolved with changes in diet and lifestyle, there are times when professional help is necessary. If your symptoms are persistent, worsening, or accompanied by other concerning signs, it's crucial to consult a healthcare provider to rule out serious conditions and receive the appropriate treatment. Below are some key indicators that it's time to seek professional help for your digestive issues. 1. Severe or chronic symptoms. If you've been dealing with digestive problems for an extended period, such as persistent bloating, constant abdominal pain, frequent diarrhea, or constipation that lasts for weeks or months, it may indicate a chronic digestive disorder that requires medical intervention. Chronic symptoms could point to conditions like irritable bowel syndrome, IBS, inflammatory bowel diseases, IBD, like Crohn's disease or ulcerative colitis, or even gastrointestinal infections that need professional diagnosis and treatment. 2. Unexplained weight loss. Unexpected and unexplained weight loss, especially when accompanied by digestive symptoms, can be a sign of more serious conditions such as gastrointestinal cancers, malabsorption disorders, or infections. If you notice that you are losing weight without any significant changes to your diet or exercise routine, it's crucial to seek medical advice, as this could indicate a deeper problem. 3. Blood in stool or vomit. The presence of blood in your stool, whether it's bright red or dark and tarry, should never be ignored. Blood in the stool can be caused by a variety of conditions, ranging from hemorrhoids and anal fissures to more severe issues like gastric ulcers, diverticulosis, or colorectal cancer. Similarly, if you notice blood in your vomit or if you're experiencing vomiting along with digestive symptoms, seek medical attention immediately. 4. Difficulty swallowing or persistent heartburn. If you have trouble swallowing food or experience persistent, severe heartburn that doesn't respond to antacids, it could be a sign of a more serious condition like gastroesophageal reflux disease, GERD, esophageal stricture, or even cancer of the esophagus. These conditions require a medical professional's expertise to properly diagnose and treat. 5. Sudden and severe abdominal pain. Sudden, Intense abdominal pain, particularly if it's localized and sharp, could indicate a serious issue like appendicitis, a gallstone attack, or an intestinal obstruction. These conditions require immediate medical attention to avoid complications. Conclusion: taking control of your digestive health. Digestive issues like excessive gas, bloating, and foul-smelling stools can be more than just an uncomfortable nuisance. They can be a signal from your body that something needs attention. While these symptoms are often linked to poor diet, stress, or lifestyle habits, they can sometimes indicate more serious underlying health conditions. The key to managing your digestive health lies in understanding the root causes, making the right dietary and lifestyle changes, and knowing when to seek professional help. By adopting a gut-friendly diet, reducing stress, and paying attention to warning signs, you can improve your digestive health and prevent these issues from affecting your quality of life. Remember, your gut is deeply connected to your overall well-being, and taking care of it is crucial for maintaining optimal health. If you're experiencing persistent symptoms, don't hesitate to consult with a healthcare provider who can help identify the cause and guide you on the best path toward recovery. Your body communicates with you through symptoms, so listen to it, take action, and make the changes that will lead to better health. Thank you for watching, and be sure to subscribe to Dr. Health for more helpful health tips and information. Take care of yourself and your gut. After all, it's the cornerstone of your well-being.